Hello, and welcome to this webinar on the microbiome and musculoskeletal disease. My name's Frances Williams, and I'm Professor of Genomic Epidemiology at the Department of Twin Research, King's College London, and an Honorary Consultant Rheumatologist at Guy's and St Thomas's Hospital. We're delighted to be able to contribute to this series of webinars, celebrating and thanking the twins for their contribution to our research over the last 30 years.
Hi, I'm Nathan Danckert. I'm a research scientist at King's College London. My main area of research is in the microbiome. The microbiome, for those of you who don't know, is a community of bacteria. These communities of bacteria are found in and on many of our body sites, so in our mouth, in our guts, and on our skin, amongst many others, but they're also in the environment, so on our buildings that we use, in the soil and in our water, for example. The easiest way to kind of envision a microbiome is think of a rainforest. So a rainforest is a community of plants and animals living together in an ecosystem. Typically, the more diverse, the more plants and animals you find, the healthier the rainforest is, and that's equally true for the microbiome. In contrast, a disturbed or a challenged microbiome will have a lower diversity. So just like a rainforest, if it's a disturbed environment, you might see more weeds growing, less plants, or more competition, and that will change the overall function of that ecosystem. When we think of what can change a microbiome in humans, we know things like our diet, smoking, our different age, where we live, so whether we're living in a rural community or living in a city, but also different countries that we come from can also impact that, and that's mainly from our upbringings and our traditions. From a medical point of view, we know the microbiome is impacted by diet and vice versa. So we know that bacteria help break down food, and Tim and Sarah did a really great talk, a part of this webinar series touching on that, so you can go listen to that if you're curious. And where probably more our research lies is the microbiome also helps prime your immune system. It can really help you. And that's, again, kind of what we're going to talk to you about today.
So rheumatoid arthritis is an immune system condition. It's an inflammatory condition, which means that the joints become inflamed, typically the small joints of the hands, the feet, but it can also include larger joints like the knees and the elbows and the neck joints. It typically affects women more than men, and it can come on very early in life. It can rarely affect children, but more commonly it comes on in young women of childbearing age. We know something of the risk factors for rheumatoid arthritis. These include its genetics, and in fact, one of the very first heritability studies was performed by my predecessor, Alex McGregor at TwinsUK, and this showed that there was a really considerable genetic component to rheumatoid of around 50 to 60%. Part of this genetic component acts on the immune system genes that we know are so important for priming the immune system to lead on to rheumatoid arthritis in the presence of other stimuli. These stimuli that we know are important in the environment are things like smoking and having gum disease. And more about this will come later.
So another part of our research and some other research that came out involved with the microbiome was that we found that a bacteria called Prevotella was associated with rheumatoid arthritis. Really important point is that bacteria are often thought of as being good or bad, and it's not as simple as that. The reality is that they fluctuate between being either good, bad, or in a more of a neutral state. And that really depends on the context that you find them in. And the environment that you find them in. An example of this is we know from non-Western societies that have a lot of plant food in their diet, we find that Prevotella can help these people break down that plant material that they're eating. That's good for their metabolism. We also know that in mice studies, in these mice that have colitis, which is a gut disease, we find that it has a really negative impact on their metabolism, and also really increases inflammation in their bodies. So that's a bad example. In rheumatoid arthritis, we know that Prevotella is a really good indicator of both early onset rheumatoid arthritis and more severe rheumatoid arthritis. And that's helping us identify the disease in patients earlier, and that can help us with our treatment, which is good. But in many cases, one bacteria doesn't tell you the full story, and we're more interested in the community of bacteria and how that's enabling these bacteria that we're finding, like Prevotella, to change the ecosystem and enable a disease to occur. And from our twin samples, we found some really interesting results while looking at rheumatoid arthritis. And Fran, maybe you can tell us about some of those results.
Indeed. So as you've mentioned, Nathan, about 25 pairs of twins, actually one of them does have rheumatoid, and we and other scientific groups have shown this link with Prevotella. But we were very interested to try and understand whether it's the disease causing the bug or the bug causing the disease, or even treatment might lead to the Prevotella showing up in the gut microbiome. And so we performed a fairly unique study using the twins that have volunteered who don't have rheumatoid and that are on our database. So we conducted what's called a polygenic risk score using the genetic data that have been contributed by twins. Because we know that there are about 200 genes that have been linked with rheumatoid, we could create this score for each individual, which gives a measure of how genetically predisposed you are to develop rheumatoid. And when we looked at this score in twins versus the components of their gut microbiome, we indeed saw the same relationship. So people with a high genetic score for rheumatoid, although they didn't have the disease, still had this increased richness of Prevotella. And this has been a really important publication for us because it's shown that it's not the disease causing the bug, it's not the treatment causing the bug, but it's something that encourages the bug on the basis of the genetics of the host predisposition to rheumatoid.
That's really interesting. We've also found the oral microbiome contributes. So we know that in the oral microbiome, Prevotella, which is the bug that we found in the gut, associates with rheumatoid arthritis, also associates from the mouth. And that might indicate that it's passing through from our mouth into our gut.
It's collected by saliva, isn't it, Nathan?
It is, yeah. This is a salivary microbiome. I probably should mention that the microbiome in the mouth, there's many different areas and different communities that live like on our teeth, on the top of our mouths, on our tongues and around. So aside from Prevotella, there's also another bug called Porphyromonas. And together the microbiome, particularly these two bacteria, associate with breaking down an amino acid, and the process is called citrullination. This process produces an antigen, and the antigen is a molecule that triggers the immune system in our body. So these antigens are found in abnormally high volumes in our mouth, thanks to these bugs. But they're also found at the source of in our joints where we're experiencing the rheumatoid arthritis. And we knew that in the past, a risk factor for rheumatoid arthritis had been gingivitis. So for the past 50 years, that's been well known, which is a gum disease. And these microbiome studies have kind of linked together as to why that is so, which is really important. As a whole, so as a brief summary on rheumatoid arthritis, we know that the microbiome is a really good indicator for the bugs that we found. And that's really thanks to the twin samples that we've been able to use, which is great. So thank you very much. And these have helped us indicate the disease at a really earlier time point, which has enabled us to treat patients sooner. And it's also starting to enable us to hopefully get to a more personalised medicine point of view. So we know in some cancer studies that patients with a higher microbial diversity respond better to their chemotherapy. And we're trying to find a similar link here with rheumatoid arthritis to see if we can define a microbial community that will respond better to a specific treatment so that we can allocate the correct treatment to those people sooner so they get better and get treated better sooner.
That's right. Thanks, Nathan. So twins are a fantastic bridge from laboratory studies in animals to human studies. And we've taken our results that we've obtained from twins, and we've obviously published them or are in the process of publishing them. And we're moving now into patients. And we're recruiting patients at Guy's and St Thomas's and at other hospitals who have very early onset rheumatoid arthritis. And we're collecting serial stool and saliva and blood samples from them as we start them on treatment. We know that in rheumatoid, it's really important to start treatment early and for it to be effective, but we don't know which drug is going to suit which patient. And so we go through this sequence of drugs, starting with a very low dose and building up. And we may get to a high dose and find that drug hasn't worked for a patient, and then we have to switch to a new drug. All the time we're doing this, the condition is causing bone and joint damage, which we know is irreversible. So there's been a huge drive over the last 10 or 20 years to aim for personalized medicine. and to get patients treated as fast as possible with rapid referral to hospital and rapid use of these so-called disease-modifying drugs. The use of the microbiome is going to help us, we hope, to work out which patients are susceptible to responding to which drug. So we've recruited these patients in the hospitals, and we're comparing, in work that's ongoing at present, we're comparing their microbiome response to methotrexate, one of the drugs, and sulfasalazine. And then we collect x-rays of their hands down the line at 3 or 6 months, excuse me, and see which patients have got the best results. So this is really helping to lead us towards personalised medicine and a more rapid treatment of rheumatoid arthritis in the future. So that's been great, and we can only thank the twins for their contribution, and the patients as well, of course. Perhaps, Nathan, you'd like to say something about an even more common musculoskeletal condition, which is close to our hearts in TwinsUK, and that's spine and back pain.
Yeah, so as Frances mentioned, another focal point of ours is researching into lower back pain. So most people listening will have experienced lower back pain, or at least know someone who has, because it's really debilitating. We know that there's a smaller number of people that have lower back pain get disc degeneration, and disc degeneration is a naturally occurring process with age, and that's where the soft tissue between our bones starts to compress due to wear and tear, and these bones kind of move closer together. The discs are actually made of this cartilage-like material that's found between the bones of our spine, and they're called the vertebrae. In a small cohort of those people, we can find lesions and some inflammation on the bone and around the bone. And really little is known as to why these lesions and this inflammation is occurring. And that's really the focus of what our research is and what we're trying to understand.
That's right. Thanks, Nathan. So 1,000 twins very kindly volunteered for spine imaging back in 1996 and came up and had an MR scan of their spines. And then roughly half that number were re-invited when I joined the department to come for a follow-up study so that we could look at the changes with age that happen. This was one of the first collections in the world that studied people who were sort of sitting at home. A population sample is what we call it. These are people that are different from folk that attend the hospital with back pain. So we were one of the first cohorts to have a really decent sized sample of spine imaging. And we've been working on these scans ever since 1996 and continue to do so. So they are hugely valuable. And we're now using all sorts of new technology and like AI and artificial intelligence to read them automatically to see if we can advance the field still further so that we're not reliant on individual humans who can make errors reading imaging, but that we can have a very sort of agnostic way of reading them in a very unbiased, systematic way, allowing us to collect very large samples and read them very quickly. So we've shown that these lesions on the vertebrae coincide with little fractures at the end plate of the vertebral bodies. And what's thought might happen is that these little fractures that we can see at the end plate of the vertebra might actually be allowing some bugs to flow into the bone. And this is the focus of our new studies that are moving again from twins towards patients. And we're recruiting patients who are attending the hospital and other hospitals for spine surgery. This is a very tiny proportion of people, around 1% of people with back pain are referred for spine surgery, and asking them if they would mind us collecting the material that's taken at operation instead of chucking it in the bin, which is what normally happens.
Yeah, we're really fortunate to use these spine samples for some of our microbiome studies. So we know from previous research that's been done, as Franz kind of mentioned, a bug called Cutibacterium acnes, which is found on our skin, in our gut, and in our mouth, has been found on some of these disc samples that have been removed. The spine was previously thought to be sterile, so that alone has gotten people really curious as to what is happening. But these older methods that have found these bacteria use an older technique that grow bacteria in the lab. These methods are really important for microbiology, but they are really limited in what they're going to find. They're going to find a smaller number of bugs rather than the full community. That's where our kind of area of research kind of comes in. So we're going to explore it a bit further. We're going to use some more cutting edge technologies to define what we hope to be the spine microbiome, because if there's one bacteria, there's normally a community there instead of just the one. And this would really help us to find a much clearer treatment plan for these people with this severe disc degeneration, because previously, as we've discussed, there's really little known.
That's right, Nathan. So we're trying to take forward this field by moving away from conventional microbiology, in which you have to guess what you're going to find and you grow up your cultures of microbes on a Petri dish, towards a much more modern approach using genetics to tell us in far greater detail all the different types of bugs that are in what we hope is in the spine samples that we receive. And not only that, we hope to find out where these bugs are coming from, because if we can do that, then we're really going to be able to make inroads into this enormous problem that is back pain. So we really hope you've enjoyed the webinar on our musculoskeletal diseases of choice today. We hope you have a flavour of just how critically important the twin contribution has been to our 30 years of research in these fields. And we really hope that we'll be able to update you with some exciting findings and some advances in personalised medicine in the future. Thank you for listening.